So before we go into hypo and hyper secretions for these hormones, there's a key idea that you need to start to think about to better understand why we see the effects with these hormones that we do in pathological conditions. So the key idea is that we have a way to decrease blood glucose levels, and that way we decrease blood glucose levels is through the singular hormone known as insulin, released by beta cells from the signal of an increase in blood glucose levels with the desired effect to decrease blood glucose levels. So the goal of insulin is to decrease those blood glucose levels. Now, alternatively, we also discussed glucagon. And as we discussed glucagon, we talked about the signal for glucagon being a decrease in blood glucose levels with the effect to elevate or raise the blood glucose levels. So we have one hormone over here that can decrease blood glucose levels, but when we looked at glucagon released, we made note of some other hormones that have the ability to influence blood glucose levels to help elevate blood glucose levels. Recall that both epi and cortisol are going to be stress response hormones that can influence blood glucose levels to help elevate those blood glucose levels. That growth hormone through adulthood is also going to be contributing to monitoring and altering blood glucose levels to boost those levels again. And we discussed thyroid hormone having a more indirect effect, but being able to sort of slow the metabolism of the body so not as much blood glucose is needed to support the tissues. Considering these 2 points then, one way for us to decrease blood glucose and multiple ways for us to increase blood glucose, it then makes sense that we are far more likely to see pathologies with insulin because we only have one way to decrease blood glucose, but it is relatively uncommon for us to see issues with low levels of blood glucose because we have so many mechanisms in an organism to be able to combat low levels of blood glucose. So to summarize, pathologies are going to be reasonably uncommon with low blood glucose levels. That's not to say that a patient might not experience a hypoglycemic situation. Hypo means low blood glucose. However, it's far less common because we have a myriad of ways to be able to engage the body to elevate those blood glucose levels. However, insulin is our only means that a body has to reduce blood glucose levels, likely because over the last 10 to 20,000 years, it was far more common for a body to go through a famine, low blood glucose levels, than feasting all the time, which is the high blood glucose levels. The high blood glucose levels and the need to release insulin is really an issue of the post-industrial revolution, where we now have abundance of food in the United States that leads to these pathological conditions. And when I consider the pathology associated with endocrine disease, I always have to remind myself that there can be a signal issue or there can be a receptor issue. So depending on whether the signal or the receptor is the fault, that would then influence the treatment that I would look at for the patient. So now we're ready to look at hypersecretion. The first thing you notice is that we have a label of insulin because we're only going to consider hypo and hypersecretion for insulin. This is an artifact of the body having multiple ways to increase blood glucose levels. So seeing hypersecretion is a far less common condition. We're going to focus our energy and attention into the direct effects of insulin and what happens when a body has too little or too much of that hormone. We're going to start specifically with hypersecretion because it's the simplest of the two pathologies to consider. And we're going to draw a little diagram here to remind ourselves about homeostasis and what ought to be happening with glucose levels. Recall, with homeostasis, there is always a set point for the value that we're looking for. And in the case of blood glucose, there isn't really a finite, it's not like 98.6 degrees with temperature. However, there is an acceptable range. So around the set point, we're going to draw a line to represent what the high and the low level of acceptable blood glucose levels is. Now, this is important because this is the amount of blood glucose that supports the body in its day-to-day action without creating any pathological states, whether that's because there isn't enough or because there is too much. So the way that this system would ordinarily function is that if I was eating a meal, my blood glucose levels might have been low, so I might have gotten hungry, and if I was eating a meal, my blood glucose levels would rise, and at the point that it rises, this would be the point at which insulin is released. And when insulin is released, if it's in a low enough dose, it should help bring me back to my normal, somewhere between the two bumpers of the acceptable high and the acceptable low. Conversely, if I'd gone a long time between meals, my blood glucose levels might fall and drop down here. And when we get to the low end of the acceptable range of blood glucose, we would expect the alpha cells to release glucagon to help bring my blood glucose levels back up into normal ranges. So these two hormones are working opposite of each other to help keep the blood glucose levels within this homeostatic range of blood glucose. Now, when a meal is consumed, we are, depending on the meal, and particularly if consuming high glycemic index things, we're going to find a massive dose of glucose entering into the bloodstream. So if I eat a meal, my blood glucose levels might rise. Here is the point at which insulin would be released. And if I release a light dose, my blood glucose levels should come back within those normal ranges. But if I consume a food that has a lot of glucose in it, if it's a high glycemic index, if I binge an entire tub of ice cream or eat a giant slice of chocolate cake, my blood glucose levels might rise, but my pancreas might overproduce the insulin. And if it overproduces the insulin, that's going to send my blood glucose levels down much lower, not just into the normal range, but may even drive them down to the opposite side, which means at that point, the pancreas would have to respond by using glucagon to bring me back up into the normal range. So I bring this up as a reminder of how these systems are supposed to work to be able to understand the hypersecretion component of this. And hypersecretion is relatively uncommon. It's not the most typical pathology that we see. And this is, if I have a hypersecretion, the effect is to dramatically lower blood glucose levels. This may be a really dramatic effect. Now, as a layperson, you probably call this a sugar crash. This is when the blood glucose levels go too low because so much insulin was released that we drew too much glucose into the liver cells, fat cells, and muscle cells. Now, if you do crash and you get to those low blood glucose levels, the signs and symptoms, I'll put S and S, that we typically see can include things like nausea. We may see things like confusion if there isn't enough blood glucose to support brain cells. What else would we see? Nausea, confusion, maybe hunger, to try to bring in some blood glucose to overcome that overproduction of insulin. We can combat this pretty easily by controlling diet and trying to consume things that have carbohydrates, that have sugars, that are what we call low glycemic index, meaning that they are gradually released into the system, as opposed to high glycemic index foods in which that's where that sugar crash is going to take place. Okay, so then we need to turn our attention to hyposecretion. What happens when there's not enough insulin available? And what we're going to find is elevated blood glucose levels. So without insulin, there are few mechanisms to be able to have a dramatic effect in lowering those blood glucose levels. Now, If we have elevated amounts of blood glucose, a number of features start to develop. We see a number of symptoms within our patient. With sugar in the bloodstream, we might start to see sweet smelling breath, sweet odors coming because there is such an abundance of glucose within the bloodstream. Amounts of blood glucose, that's going to also alter where fluid is balanced. So a couple things happen. More glucose in the blood attracts more water, so overall the volume of the blood goes up. And in addition to that, if the volume of the blood goes up, that comes with an unintended side effect of increased blood pressure. Most patients who have a hyposecretion of insulin have elevated blood pressure as a side effect. Now, with increased blood volume and increased blood pressure, the kidneys respond by increasing the urine output. It causes the patient to pee more. Now, these are all symptoms that are going to continue to build over time. There's a couple other symptoms we want to think about that happen as long-term symptoms from elevated blood glucose levels because insulin isn't functioning correctly. Sometimes joke that this is job security. So long-term effects that we're going to see from elevated blood glucose levels oftentimes come because that glucose molecule then starts to accumulate in tissues. It can accumulate in skin and change the consistency of the skin, so we start to see skin changes. It can bind to red blood cells. You may be familiar with an A1C test, and bind to other proteins. This can cause alterations in the physiology and functioning of the immune system. Additionally, with all that increased blood pressure and increased urine output, this can overwork the kidneys, and kidney failure is a very common side effect, long-term damage associated with elevated blood glucose levels, as well as seeing neuropathy and damage to neurons. Lastly, it's also important to note that an elevated amount of blood glucose can be associated with irritation of blood vessels, and when those blood vessels get irritated, that increases the likelihood that cholesterol plaques can start to accumulate. So we actually start to see things like heart disease and cardiovascular function loss as well. Sounds fun, right? Cardiovascular function failure. So you can see there's a lot of issues when we don't have enough insulin, and not nearly as severe of an effect if we have an excessive dose of insulin released. Now, we're going to move into a discussion of diabetes, but I want to point out that hyposecretion does cause what you might have heard of as diabetes, but we need to elaborate because this is a form of diabetes mellitus. And we need to go into the weeds to understand that there are multiple forms of diabetes, and it's either the signal or the receptor that can lead to symptoms with our patients. Forms of diabetes, and it's either the signal or the receptor that can lead to symptoms with our patients. Okay, we need to consider then forms of diabetes. So let's take a quick moment to consider what diabetes means and what the result is overall for pathology. So, diabetes, when broken down into its most simplest meaning, roughly translates to increase urine, aka time to pee. Now, when we are talking about diabetes, from a clinical standpoint, there are two broad types of diabetes that are recognized from two separate root causes. So, for a change in insulin or the receptors that would respond to insulin, we call this form of diabetes mellitus. However, if you have observed or listened to my video on antidiuretic hormone, you may be familiar that there's another form of diabetes called diabetes insipidus. So, when I'm thinking about diabetes mellitus, we have to be putting our mind to thinking about sugar and its influences on the body. And when we're talking about diabetes insipidus, we're talking about water effects. So if we look at diabetes as sort of this broad-reaching generalized term that means any condition in the body associated with a hormone disorder that's going to lead the body to increase urine production and or aka pee more. So from a previous video, diabetes mellitus is what we call water diabetes. Sorry, I said that wrong. So from a previous video, we discussed that water diabetes is called diabetes insipidus, and this water diabetes can be associated with either the signal or the receptor. So if the signal is off, that means that antidiuretic hormone is, for whatever purpose, not being released from the pituitary gland, and that means that we don't have the signal for the kidneys to be able to reabsorb water. End result, peeing a lot because of the water. We also might see that the receptor is non-functional, and the receptors are going to be in the kidney in this case. Oftentimes this is called nephrogenic diabetes insipidus because the nephron is the specific part of anatomy, the pocket of cells that has the ability to control whether water is put out into the toilet or returned to the body. Then our other form of diabetes, the sugar diabetes, is called diabetes mellitus. So these are the two broad pathological forms of diabetes that are recognized. We talk about sugar diabetes or diabetes mellitus, and we talk about water diabetes or diabetes insipidus. For sugar diabetes, diabetes mellitus, we also can see either a lack of the signal, in this case insulin, being secreted by the pancreas, or issues with the receptors. We oftentimes refer to these as insulin receptors, and as we've learned, there are three tissues that have these insulin receptors: the liver, the fat cells, and the muscle cells. What that means is that cells have other ways to bring glucose in, but when we have elevated blood glucose levels, it's these three key tissues that are going to respond to help store that glucose for use later during a future famine, opposite of the current feast. So let's summarize the key points. We have just finished talking about two different hormones that are secreted from the pancreas as an endocrine gland function. One is glucagon, the other is insulin. Glucagon is released by alpha cells in response to a decrease of blood glucose levels, whereas insulin is going to be released from beta cells when there is an increase in blood glucose. The effect then of each hormone is to do the opposite of its signal. In the case of glucagon, we see a increase in blood glucose levels. This is a function of glucagon, but as we've discussed, also a myriad of other hormones, because making sure that you can survive a fasting period has been more critical to an organism's biology than figuring out how to survive a period of feast. Now, the effect that we see typical of insulin is to help bring our blood glucose levels back down into normal homeostatic ranges to keep us out of the dangerous pathological states. In pathologies, because there are so many ways for glucagon to and as well as other hormones to increase the blood glucose levels, pathologies tend to be reasonably uncommon with low blood glucose levels. However, we only have one hormone system in place to be able to elevate our blood or get our elevated blood glucose levels back down into homeostatic ranges. So as such, we are far more likely to see pathologies over here, and the pathology that we have talked about is that condition of diabetes mellitus. The pathology of hyposecretion of insulin is what creates diabetes mellitus type 1, and when the receptors are less responsive, that creates the pathology of diabetes mellitus type 2. I hope this video was able to help you connect the ideas that will help you be successful on your next exam.